Hello, everyone. My name is Jenna Cavello. I am in Post University's MBA program with a concentration in healthcare systems leadership. Today is August 9th, 2025, and I have had the pleasure of having Dr. Mike as my professor of this course. I am really excited to present my Capstone project that is focused on improving access to echocardiographic testing at Charlotte Hungerford Hospital. This project identifies a growing backlog in outpatient echocardiograms and proposes feasible cost-effective strategies to enhance scheduling, reduce wait times, and improve both patient and staff satisfaction. Here's a little bit of background on Charlotte Hungerford Hospital. Charlotte Hungerford Hospital is a very small community hospital. It's located in Northwest Connecticut in Torrington. It's a partner of Hartford Healthcare's Heart and Vascular Institute, and the Echo Lab operates with two primary echocardiography rooms, one of these being in an outpatient satellite office and one of them being at the hospital. The echo department plays a vital role in providing timely cardiac services to both inpatients and outpatients. Getting these echoes are really essential for early diagnosis, treatment, and care. The problem at Charlotte is that there is a growing wait list for outpatient echoes due to the increased demand for cardiodiagnostic testing. This leads to delayed diagnoses, which poses significant consequences to patients, clinically, and the overall organization. Here is the current state of Charlotte Hungerford Hospital. Basically, the appointment's scheduled. There's a really long waiting period until the appointment. Sonographers have to call the patient if time allows to confirm their appointment. And next, the patient arrives at Charlotte. It checks in through the front desk. The patient has their echo, and then the patient usually has to wait a very long time for their echo to get read, which leads to delays in diagnoses and decreased patient satisfaction. So the project goals. The goals of this project are to improve outpatient echo scheduling efficiency, to optimize staff and resource utilization to decrease burnout for all staff, to minimize appointment no-shows and cancellations and late arrivals, and to enhance patient satisfaction. Root cause analysis. The five whys is really essential for the root cause analysis because it really gets down to why the problem is happening. So the problem isn't happening just because of staff shortages and limitations in appointment slots, but it's actually rooted from the absence of a formalized process for dynamically adjusting the template for scheduling patients. There's really no mechanism to respond to changing patient demands and scheduling staffing availability. So this system for scheduling remains inflexible. That's what it came down to. Another tool that is really essential for determining the root cause analysis is a fishbone diagram. As you can see, there are six different categories that include people, processes, environment, technology, policies, and resources. And you can really just see all of the issues in each of these categories. SWOT analysis. So the SWOT analysis is always important because you can really see the internal and external factors that are highlighted within a problem. Um, so the strengths are that the hospital has a really great team. There's highly skilled cardiac sonographers and doctors. The hospital is affiliated with Hartford Healthcare's Heart and Vascular Institute, and it has a really strong community reputation. The weaknesses are limited staffing, space constraints, absence of formal triage protocols, and uneven workload distribution, which leads to staff members being burnt out. Um, Opportunities lie in implementing advanced scheduling technology, expanding outpatient capacity, developing clear policies for cancellations and late arrivals, and integrating tools like automated reminder systems and AI-assisted scheduling. Lastly, the threats. Threats include increased competition from facilities that allow patients to have quicker appointments, the risk of losing patients and downstream revenue, and the decreased clinical outcomes that come from delays in diagnostic readings. The cost of inaction. If the hospital decides not to do anything, patients will seek care and testing at competing facilities. There will definitely be a significant loss of revenue from missed appointments and opportunities, and the reputation of the hospital and the trust from the community will also be decreased. Here is the cost benefit analysis if the hospital were to hire a per diem sonographer, which would help with the backlog and would fix a lot of the issues when it comes to staffing availability. So as you can see, there is a projected um, there's a projected gain of $514,000 annually if the hospital were to hire a new tech. This is a huge financial gain, and really just shows how significant this would be. As you can see in the table, the estimated cost to hire a sonographer is only $66,900, and the projected generation of financial gain is at the bottom, $514,000. The saying time is money. So the saying really makes sense in this case. The growing backlog really serves as a clear reminder that in clinical imaging, time directly translates to financial loss. Here's some examples. If one additional patient is scheduled per day for the next 120 days, the hospital can earn $74,640 in additional Medicare reimbursement. That's from one extra patient a day. If two or more studies were added per day, the potential reimbursement doubles or triples. So that just shows how the hospital really needs to fix the scheduling system and editing the template so that the lead tech can access this and open more slots. Here is the investment break even and ROI summary. This is basically just saying like, here is how much the total investment is, which is hiring the new staff. And it also is including like labor, supplies, equipment, training for the staff member would be around $66,900. The annual revenue from this would be $581,000. The break-even point would be 1.4 months, and the ROI is 767.7%. The future state of CHH. So this would be the future state that would be beneficial for the hospital. So the provider would order an echo that clearly states the diagnosis and priority of the echo. The patient would then be triaged, and the scheduling department would find the earliest slot and would determine if the patient is a ASAP patient and an urgent patient. If they are, they would get placed on an urgent wait list so that they can get seen much sooner. Next, the appointment is scheduled within the same month. Instead of 4.5 months, we want this to be the same month. Next, the scheduling department will automatically send out educational packets and videos to the patient to inform them what test they're getting and what will happen in this test so that they are prepared and less nervous for their test. Next, automated confirmations via email, text, and phone call will be sent out to the patient 48 and 24 hours before the scheduled appointment. Determining if it's email, text, or phone is up to the patient. The patient will arrive at CHH, the patient will get their echo, and then the echo will be read and finalized by a doctor on the same day as the echo is done. Conclusion and feasibility. In conclusion, yes, this project is financially feasible and sustainable at Charlotte Hungerford Hospital's Echo Lab. The projected new annual benefit from decreasing outpatient backlog and hiring more staff is more than $500,000, driven by increased scan volumes, patient retention, and additional referrals. The required investment is minimal in comparison to the potential returns, making this a low risk, high reward initiative. That is my references that I use for my paper. Thank you all for listening to my project, and I wish you all the best of luck. Thank you.